to talk a little bit about the recovery from orthognathic surgery, what we also call jaw surgery, or reposition the jaw bones and line up the bite. We do a lot of it for sleep apnea as well. But we do these procedures in our outpatient surgery facility here in our office, and we recover you here for the first hour or two, and then you go to your home, and one of our nurses will accompany you at your home for the first several hours to get things started for you, and it's worked out very good. And so as far as the surgery goes, there's 4 things that are a big deal. For me getting it next week, I think, what am I going to go through? So, number 1 is a lot of swelling. Number 2, there's almost no pain. Number 3, you're on a soft diet for 6 weeks. And number 4, you need about a week, week and a half to recuperate. So let's talk about the swelling. So number 1 is you get a lot of swelling in your face. That's very significant to the point that everybody that sees you for the first 2 weeks will know you've had some swelling. But there's actually a benefit to that, because the swelling is actually, part of it is in the bone from us moving your bones around. And so the nerves provide the feeling to the area, get a little swollen. So you get some numb lips on the top and on the bottom if we do both jaws. And that actually keeps it from hurting. And believe it or not, most people after a day or 2 use very little pain medication. And the other great thing about this, these nerves that get numb, they do not move your face. So you smell normal, look normal, they just provide feeling. Then in a few weeks in the upper lip, you start getting your feeling back a little longer in the lower lip. So by the time your feeling comes back, most of your pain's gone. So it's a pretty awesome thing. It's like we can do all these resetting and it's not real painful. So the third thing about this is you're on a soft diet for 6 weeks. So we move your bones around. We don't break your jaw like was done a long time ago. People say it's a very precise cutting. We reset the jaw bones, and we use these titanium screws, little bone plates, mini plates we put in there that secure the bones in the new position. So you wake up, you can open and close your mouth. It's a little stiff the first week, but our rule of thumb is you can chew soft foods. Anything as soft as macaroni and cheese or softer, which covers things like pasta, meatloaf, cooked seafoods, tilapia. So you can, it's pretty much a non-chew diet, or it's a soft chew diet for 6 weeks. And it seems like that's not a big deal, but about week 4, people really crave pizza and tacos and things. But, so that's a little bit of a thing. It's a soft diet for 6 weeks. And the 4th thing is it takes about a week or 2 to get your energy back. So for students, we say take a week off school. You really need a week and a day. And for so we do a lot of these during the winter break, spring break, summer break. And adults, you know, we do it all year round on adults that are in school. And so the way it works is your first week, if we do a lot of these on Tuesday. So if we did it on Tuesday, Wednesday and Thursday you feel pretty good because we give you a steroid called Decadron that cuts down on swelling, but it gives you like a runner's high, a boost of energy. So Wednesday, Thursday you feel pretty good. Friday and Saturday, then you drug, you get up, you get a low, you feel a little depressed. So that weekend, like day 5 and 6, you're a little bit down energy-wise, and then day 7 and 8 you recover. And so if we did it on Tuesday and you had to go back to work, I'd say go back to work the following Wednesday, 8 days later, and maybe work part-time. Because it's really a matter of getting your energy back. It's everything from here down works great the first day. It's just you're living with a up and down in energy and a really stiff swollen jaw and getting used to some numb lips. But after a week, people, they're used to the numbness, have enough feeling back, they can eat. So it's a pretty quick recovery. But the first week, you know, it's a week of a hassle of a stiff swollen jaw. The other thing about this surgery is you think, okay, resetting jaw bones. What about infections, wounds not healing, bones not fusing? Well, the facial area has a great blood supply. And so the thousands of these I've done, I've never seen anybody get a severe infection. We don't have problems with the wounds not healing, the bones not fusing. So it's a very smooth, uncomplicated procedure for the most part.